You're listening to Risk and Resolve, where leadership, business, and risk management collide. We bring you real conversations, sharp insights, and strategies for success. And now for your hosts, Ben Connor and Todd Hufford.
Good morning, everybody. How you doing? One of those wonderful sons of mine asked me the other day, did you have color televisions when you were a child? Back in the 1900s. And yes, I was born, in the 1900s. And when you say it that way, it kind of has this acidic, taste, but the year 1900, I wasn't born in that year, but that was the year that The Wizard of Oz was written, the book, The Wizard of Oz. And it was turned into a play 2 years later. And then in the 30s, it became a movie that we're all very familiar with. Now, why am I talking about L. Frank Baum's The Wizard of Oz? Well, it's kind of a circuitous tale, so I hope you'll find it interesting. Back in the 60s, a statistics professor, a world-renowned statistician, invented a branch of statistics called stylometry. Stylometry is using mathematics and statistical models to analyze the style of writing. And so that if you could analyze someone's style of writing, much like a fingerprint or a signature, you could tell who wrote something just by the style, completely ignoring the content of what they had written. And so this world-renowned statistician studied Frank Baum's works of The Wizard of Oz. Why? Because when Frank Baum died, he'd already written 13 books for The Wizard of Oz, and they were so popular in the early 1900s that the publisher found another author to continue the books, but to try and maintain the same voice, the same feel of those original books, The Wizard of Oz. And so fast forward to the 60s, statisticians always come up with really weird things to study. So just another weird thing. The statistician in the 60s decided, hey, what if we apply stylometry to The Wizard of Oz corpus? If you call it a corpus, it sounds a lot more fancy and kind of sacred. And let's see if we can tell the difference between the authors, because back in the early 1900s, people couldn't tell. The new author did a very good job of mimicking Frank L. Baum. So let's fast forward to the early 2000s. I am related to that statistician in the 60s through lineage of my academic advisor when I was in this graduate school of statistics. My academic advisor studied under that guy that did that original work analyzing Frank Baum's work. And so I was reading about my grandfather in statistics, and I went to my dad in statistics, and I said, hey, why don't I do something similar? And he was like, I don't think that's a good idea. And I said, why? And he said, well, I don't think you'll graduate on time. That's really hard stuff. And I was like, no, I'll do it. I'm really disciplined. I'm going to make it work. He's like, fine, put your thesis together and let's figure it out. And just make sure you graduate on time, because you are not going to be the first graduate student that I have that doesn't graduate on time if you don't finish your thesis statement in time. And so I went and did some research, and I came back to him and I said, hey, I found what I want to do. I want to study ancient Greek texts. And he was not happy when I said that. Because he's like, The Wizard of Oz was in English, and you want to study texts in Greek, but not even modern day Greek, ancient Greek, which is no longer spoken. And I said, yes. He's like, do you know ancient Greek? I said, no. He said, what are you going to do about that? I said, I'm going to learn ancient Greek. I already registered for an undergraduate course to learn ancient Greek. And he said, well, machines can't read Greek. And I said, well, I'll have to build software that can ingest the ancient Greek and translate and understand it so I can build my model. And he basically forbade me from doing this project. He's like, why don't you do something like everybody else does? Baseball, football, some very straightforward statistics. And I was like, no, this sounds really interesting. He's like, okay, well, what are the texts you want to analyze? He's like, well, I want to analyze the most disputed ancient Greek texts of all time for the last 2,000 years. Last 2,000 years. And I said, the best one is the book of Revelations. Maybe not in this room, but for the last 2,000 years, there's been a huge battle about who actually wrote the book of Revelations. I said, if I go and gather works from the last 2,000 years of contemporaneous authors, I should be able to build a model that can analyze the style and predict mathematically who wrote the book of Revelations and finally put this 2,000-year-old debate to rest. And he really didn't like the idea, but I convinced him. He's like, fine, just do it. Just make sure you graduate on time. So I spent the next 12 months doing all those things I said. I had to take ancient Greek, so I learned ancient Greek. I had to build software that could read ancient Greek. I had to find the ancient Greek that was digitized so I can ingest it into the computer model. And I started publicizing this. And just to kind of give an idea, these presentations in statistics in graduate school are not well attended. You're standing in a room this size, but there's only one table, listening to your thesis. And I'd mentioned many myself. No one goes to these things because they're usually about some esoteric data that no one cares about. But for mine, because word got out, pastors from all across Minneapolis came to my master's thesis because they're like, what's this guy going to say about our book? He better not say anything bad about our book. The guys in the Near Eastern Classical Studies department, the people that teach ancient Greek, they're like, whoa. This guy's applying math to what we've spent decades studying. We got to come and see what's going on here. And the best part, my own professors came, statistics professors came, and the room was full. There was standing room only because everybody wanted to know, did this guy actually use math to analyze the style of ancient Greek texts and predict who the author of the book of Revelations was? Stylometry. And I think I did. And the reason I tell you this story is that was a really hard problem. I like hard problems. I like to do very hard things. I like to lift very heavy weights. And I think all of you are the same way. You're all the same. We're the same. You could have chosen anything, any problem, but yet you chose this decades-long problem of trying to solve healthcare, what ails us. Why, we couldn't even agree on what exactly the problem is. We know what the outcomes are. People are unhealthy. People don't have enough money to do the things that they love. We know these outcomes. People cannot perform their best at work. We could agree on the outcomes, but we couldn't agree on the problem. It's one of the hardest problems in modern day history, and yet we have a room full of people here that are trying to solve it. In much the same way I tried to solve this problem of who wrote the book of Revelations. And I believe it is possible to solve the problem. I believe we have the human power, the energy, the intellect, but most importantly, the desire to solve this problem. And I want to put forward to each and every one of you in this room that the most important ingredient to solving the healthcare crisis of this country is desire. It's the will to want to solve it. Because you could put all sorts of fancy words and names around what Hancock Hospital did, right? But if no one wanted to do it, it wouldn't have gotten done. When things got hard and no one wanted to persist in trying to get people with diabetes to change their behavior, it wouldn't have gotten done. So it's desire, and it's the collective desire of everyone in this room. If we could bottle up that desire and apply it to healthcare in its most pure form, we will overcome this issue. And why bother overcoming the issue? It's for my 15-year-old and my 9-year-old. It's for your parents who may be on Medicare or Medicaid. It's for the people that are coming after us. It's someone's job to fix it, and apparently everybody in this room thinks it's their job to fix it. So let's do it. Let's do it, but let's not lose sight of that. We have to have the desire. We have to want to do it. Like I want to do some things with my body, but I also love cake. My employees know I love cake. A couple years ago, Jory, my colleague over here, he drove up to my house in his big truck and dropped off an entire cake from my favorite bakery. And I had a decision in that moment to make. Am I going to cut a piece off and put the rest in the freezer and kind of discipline myself and eat this over some course of time? I didn't. I ate the entire cake, in a week because I desired the cake more than I desired a six-pack. All right, so let's focus on desire. And I'm going to take you through what Nice Healthcare does and, how we did it and why we did it. Why did I start Nice Healthcare? I'm not a clinician by training. You've already heard about that. I started off in the healthcare field as an economist. I was analyzing data, building models, trying to predict who's going to be the riskiest and most expensive person in the room. And I was pretty young back then, but it wasn't until our first child was born that I was thrust into actually becoming a user of healthcare. Much different than analyzing millions of rows of data and come up with all these fancy models and suggestions for the actuaries and the sales team and product, at a health plan to implement. I was thrust into using healthcare, and I wasn't even the one doing the hard work. Like my wife was the one going to all the visits, the birth itself, the afterbirth. I was just like along for the ride, and I could see how disjointed and discombobulated everything was. And as if that wasn't enough, now we had this new human being in the world that was also going to be consuming healthcare. And I remember distinctly when he was 1 year old, he came down with a very aggressive cough and a fever. Like should have been pretty normal stuff. He suffered from febrile seizures, so the coughs and the fevers were kind of traumatic for us. I mean, the doctor told us, oh, they're harmless, like it doesn't look harmless. So we didn't like it when he got coughs and fevers, so we were very proactive. We both worked in the healthcare space. I was in graduate school at the time. We were on an individual plan in the individual market. Super crazy high deductible, right? And so we're going to the clinic in December in Minneapolis, so freezing cold, lots of snow. And they're like, oh, it's a virus. I hate that one. It's a virus. It's so annoying. Like, it's a virus. So he'll get better, on his own. So we go back home. He doesn't get better. 3 days later, it's actually getting worse. And so we go back in a second time, and again, different doctor, right? Because it's not the same doctor. And they're like, oh, no, he's almost better. Yeah, it has to get worse before it gets better. And so we went back home a second time. This happened a third time and a fourth time. So on this fourth time in this clinic with our firstborn child, who was a year old, we're in the exam room after waiting in the waiting room. And I said to my wife, Hannah, I'm going to go look around. She's like, you can't do that. You can't just look around. Like, what do you mean look around? And I was like, I'm going to just hold on. I'm going to look around. So I left because we were still waiting there. So I left the exam room. I started walking around this clinic. I was opening drawers. I was tapping on the keyboards. Epic. I was looking in everything. The drawers were empty. The cupboards were empty. The only room that had anything in it of note was the x-ray room. And I was like, dang, that's a big x-ray. It must be a really good x-ray because it's so big. So I pulled out my iPhone and I Googled, well, how much does an x-ray cost? Like, what if I want to just buy an x-ray right now? And I was like, whoa. The first thing I noticed how small the x-rays were. And I was like, why does this seemingly newish clinic have this gigantic x-ray? I assume bigger means more expensive. That's often how things go in this life. So I went back to my wife and I was like, Hannah, I could start a clinic with my eyes closed and one arm tied behind my back, and it would operate better, have lower prices, and have a better experience than what we put up with for 4 visits now. And that was the beginning of Nice Healthcare. I started thinking, how would I do this differently? How could I make this better for the average person? Because, and again, in healthcare, don't we talk a lot about this like really small group of people driving like all these costs? It's like having like 3 children and you ignore the 2 that are getting straight A's and you're like, okay, and you spend all your time talking about this one child, all your time, all your effort. But what about all these people over here? Just regular people, that most of them don't use healthcare in a year. Like we talk about all these people using it a lot. There's a bunch of people that are paying for healthcare and they do not use it. Like imagine how that feels. And then everybody's talking about all these people over here that use healthcare while you're just quietly watching your life savings dribble away into the black box, as we heard before. And for then the next biggest group, people that do use healthcare, they don't use it that much. They just want it to work that one time a year where you need it, you want it to work really well. Like I'm sure if you have a single family home, that drain in your basement that you don't think about very much, except for now that I mention it to you. You're like, wait, like, whoa, where is this going? Like, yes, be concerned, okay? Because you don't think about that drain in your basement in the corner very often. But when you want that thing to work, you want it to work flawlessly, on time. You want to have the best customer service from that drain, because if you don't, you will have a lot of pain for weeks, if not months. That is what healthcare is for most people. Just work that one time. I think I need it. That's another reason I started Nice Healthcare. Another reason I started Nice Healthcare is I was in the industry already, and everybody was talking about the jumbo accounts, talking about the national accounts, talking about the biggest employer in town accounts. Well, what about the 10-employee company over here? 20, 50. People back then were even saying 5,000 employees is not that big. What about them? What about them? They need help too. Their healthcare costs are going up every single year. They're paying taxes, which is what it actually ultimately comes down to. I was in a room with a bunch of healthcare executives. I recently got appointed to Minnesota's legislatively created healthcare price task force. It's like the second one I've been appointed to. I'm not even that old. How could I be on the second one already? And I'm in this room with hospital executives. You know the names. I'm from Minnesota, right? So you know at least one hospital in Minnesota. And everybody's talking about, we need more money from Medicare. We need more money from Medicaid. How do we get those reimbursement rates up? These people are so sick and they're poor. So they're doing all this crazy stuff that's making them even more expensive. And I'm like, and I'm like, hold on a second. There's no such thing as Medicare, okay? There's no such thing as Medicaid. There's only us in this room. There's only us. I said this in this room. I was like, stop saying that word, Medicare. I don't think you know what it means. There's only commercial. Because who bloody funds Medicare? Who bloody funds Medicaid? It's us. It's all of you. So not only are we talking about our employees paying more and more into healthcare, they're paying for other people's healthcare as well through their federal income tax, their state income tax, through their Social Security tax, through Medicare tax. This thing is going crazy, all right? And that's why I think it's so important for all of us here in this room to recognize that if we have the desire, we can turn this around. And Nice Healthcare is just one small tool that you can use to do that. And when I started Nice Healthcare, everybody knew what the problems were, and I wanted to create something that was easy, okay? Like we've heard the word change a lot today. Have we not heard the word change? And we've heard it kind of in the negative way. But not all change is negative. It's about perception, okay? If I told you that your Toyota that is breaking down, you're going to put $5,000 into, and I could come along and say, here's a Lexus. You can have it for free. You just got to change which car you drive. That's not a bad change, right? That's like, oh, your favorite pizza restaurant? How about I deliver that pizza to you for free, and it'll be just as good as you driving 20, 30 minutes to pick it up. That's a change, right? But it's a good change. If change is perceived by the person the change is being applied to as a positive thing, it ain't so bad. It's not so bad. But a lot of times the solutions that we have to this healthcare problem are perceived as bad. We heard about how hard that was, when talking about diabetes management. So I said to myself, what if we could come up with a solution that wasn't perceived as bad? That unless you were talking to an absolute maniac, like they would perceive this as good. They may not want it for themselves, but they would perceive it as good. That is Nice Healthcare. What is Nice Healthcare? I said, well, going back to my son's story, what if that was different? What if instead of me going in the middle of winter in December in 12 feet of snow, okay, it wasn't 12 feet, it's 12 inches, but what if it all came to my house? Like what if medical care came to my house? What if I didn't have to think about, do I need to talk to a mental health therapist, physical therapist, primary care? What if I didn't have to think about, should I get this lab? Like I still remember becoming a first-time parent, and sometimes the doctor would be like, so do you want to do this lab? Like, what do you mean do I want to do this lab? Like, why are you asking me, if I want to do something? You shouldn't have to think about that. When you're thinking about the health of your child, you shouldn't have to be thinking about how much this costs Or am I closer past my deductible yet? Why are we putting ourselves through this? Why are we thinking about that? Even with our own parents, right? How much does it cost is always coming up in the conversation. It shouldn't be part of the equation. And so I said, what if we get rid of as much of those questions as possible and make this just easy for patients and employers? That's what we set out to do with Nice Healthcare. So the way Nice Healthcare works, this is where it has to get a little commercially. So bear with me. The way it works is we don't have any physical buildings in our model, but we are a clinic, but no physical buildings. And back when I was first trying to get this company started, this was back in 2011, 2012, people thought I was insane, just absolutely insane. Because I was like, okay, think about DoorDash and Uber and Netflix and mash it all together, but apply it to healthcare, and that's Nice Healthcare. Because that is what it is. We said for most of the stuff, you don't need to leave your house. Like, you just don't. Through a combination of virtual visits and in-home visits, we can provide all the care that you would otherwise get in a physical location in the comfort of your home. Some parents have told me how wonderful it is to have their child's blood drawn at home instead of in a cold, sterile clinic. People that are managing their diabetes love it because they don't have to leave work. We just come to their office and we do the thing and we get out 4 times a year and they're done. It's saving people time and saving people money. And if there's anything except for money that we all want more of, it's time. It's time. So those were my mantras when I started this company. Save money, save time. And if I can, in any way possible, make it easy to implement and have it be perceived as a positive change so there is no resistance, because all the rest of the work that you all have signed up for in terms of changing healthcare is really hard. So how about we just have like one thing be easy? Just one. Maybe there's others, but I can guarantee you that this one is pretty easy. So we started the company and it was not all roses. Oh no. How many entrepreneurs do we have in the audience? Either started a business or took over a business. Okay, saw a couple hands. Like, being an entrepreneur is painful. It's one of the hardest things that I've ever done, except for the ancient Greek thing. And I'm glad I didn't know what I was getting into, because I might not have done it otherwise, right? Like, I remember at my lowest point on this journey to getting the company to this stage, my wife is my best friend. That's who I want to be with. I talked to her last night. That's why I'm not staying another night, because I want to go hang out with my wife. And I remember when our first child, was still in diapers, and I was trying to get this company going. And there was one day where I was changing the diapers, and I knew our bank account was basically zero. Like, I knew the credit cards were all maxed out already from trying to get this going. Like, I knew. What I didn't know is that I was putting on the last diaper in the house on my son. And that was the moment where it hit me. I was like, am I cut out for this? Like, I'm putting the last diaper on my child for people I don't know, for a cause that most people in the country can't understand, let alone care about. I know you feel me. People don't understand healthcare. They check out. They don't know that you all are fighting the good fight. Am I cut out for it? And I can't believe it. Like, that day, our first customer's check came in the mail. That day, with that last diaper on. And that's one of the things that kept me going in this journey to get the company to this stage. Let's see here. Where am I going here? All right. So now we're in all these states in the dark purple. The light purple is where we only do our virtual care. For us, what we call our in-person visit, that's the key differentiator of Nice Healthcare. It's the part that's really replacing a lot of what goes on in the clinic. It's the part that people think are magical. Again, we as humans, we think a lot about the things that don't happen that much, or the small thing that's driving a lot of the change. We don't do x-rays that much. Like, how often does a clinic do an x-ray? Right? But we do x-rays in the home. Like, the whole thing comes to your house. It's smaller than this podium. If you've never seen a mobile x-ray, can fit inside a hatchback Toyota Prius type vehicle. That's one of the most talked about parts of nice healthcare is the x-ray. Very few people get them. I think what's happening is people are like, wait a minute, they're like me. All I've seen are these giant x-rays in these clinics. Certainly couldn't fit one in a car, and now you're bringing it to my home, and I'm not paying for it. I will proudly claim up here on stage that Nice Healthcare is the lowest priced DPC practice in the country. Whether it's PEPM or PMPM, cut it either way you want. We're the lowest price, but yet we're bringing all this care into people's homes. People absolutely love the time we're saving them, and they certainly love the money that we're saving them. Now, this is where I guess a little boring for people that don't like numbers, so I'm not going to stay here too long, don't worry about it. But what I'm trying to show you here is that nice is this small thing, right? We can touch about 12% of costs. But as I was describing to you earlier, that 12% of costs, again, represents about $60 PMPM in an average commercial plan. We had Milliman do this study for us back in 2022. So think about that. Nice, the care that we do, that you saw in that earlier slide, touches about 12% of plan costs. But when it comes to the people that we touch, you can see here that 74% of members, about 89% of healthcare utilizers use Nice Healthcare. Now, there's that percentage that doesn't use healthcare at all. They're the people paying into your plan, paying into Medicare, paying all. These people are like some of the real heroes, honestly, up here. You know, paying and not getting anything in return. Many of them stay healthy their entire lives, whether genetically or through hard work, and they're just paying and helping all of us pay for the care for the people that need it. Of those that use healthcare in an average commercial plan, about 89% of them use a service in a year that Nice Healthcare touches. So again, going back to the founding of this company, I didn't want to start a company for the few that drive a bunch of the costs. I want to start a company for the many that are paying to fund all the costs. Are you with me? Like not the few that are using, the many that are funding. That is one of the core missions of Nice Healthcare. It's something that most everyone can use, except that old dude that's like, I never get sick. Like, I mean, those dudes are everywhere. I am one of those people. Like, if I will admit something on stage, you know, I went 10 years without seeing the medical provider for preventative care because I was working so hard on this stuff. I was like, I don't have time, even for my own product. I was like, I don't have time to get on the app. Like, how ridiculous is that? But every year, my wife was like, why aren't you doing that? Why aren't you going? You need to go. You need to go. I also didn't go to the dentist. And you see these glasses on my face? These are like 2 weeks old. You know, because I'll thank my wife. You know, I'm 45 years old, and I was like, I just don't have time. She's like, you got to go to the eye doctor. You've never had an eye appointment. You could have some disease. You could be dying right now. I was like, I'm not dying. Like, I'm totally fine. You know, but finally I listened to my wife, and which I advise everyone to do that has a wife. And I went there, and I don't have glaucoma. I don't have like anything like that. But the doctor was like, have you considered glasses? And I was like, what are you talking about? I'm 45 years old. I don't need glasses. Well, it turns out I need glasses. You know, so I'm just giving you that example as even me, myself, I find it hard to make time to take care of my health. And I'm in the business of making it easy for people to take care of their health. So I did some data. So I'm a data nerd. I love data. I love statistics. And I want to tell you, if you don't know, Indiana has one of the best all-payer claims databases I've ever seen. I don't know if you know what the APCD is for your state, but just so you know, if your state legislature has done something good, you know, and you guys have a really good all-payer claims database. There's so much data in there. I hope that you sometime find a use for it. I certainly did when validating this analysis that I did for you today. So what I did is I focused on the Indiana State Employee Health Plan. I was like, okay, I'm just curious, like, what do they spend on healthcare? So I went and found out what they spent on healthcare. I was like, all right, well, based on my Milliman study, they spend about this much on the services that Nice Healthcare provides, almost $52 million on the services Nice Healthcare provides for Indiana state employees who are keeping your state running. I said, okay, well, if they adopted Nice Healthcare and say about half their people used it, which is a little bit lower than what we'd expect from our normal clients, so pretty conservative, what could they expect to save? Based on my calculations, it'd be a 1.8 return on investment. They'd be saving $11.7 million a year with just getting to 50% adoption within their employee population of nice healthcare. And that's in addition to saving all those people time, keeping them out of their deductibles, getting them healthier by investing in their health today so they can be healthier tomorrow. And this is just one employer, a very large employer, but it doesn't matter what size of employer you are. You can save your employees time and save them money. And if it's not with nice healthcare, do it with some DPC. I don't care who the DPC is. I'm a DPC fanboy. Like, just give it a try. Because sometimes a small change in something big can have a big difference. One of the most recent experiences for me with a small change in something big, again, we're going to use our example, Jory. Jory and I were testing out our 1-rep maxes. I don't know if anybody here does strength training, but 1-rep max, is like, the macho way of making sure you're making progress while you're lifting weights. So Jory and I are testing out our 1-rep max, and I'm doing squat. I've been lifting weights for decades, doing it the same way for the most part. And Jory is standing behind me. He just casually says to me, if you lower the bar, 1 notch, I think blah, 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 blah. And I was like, I've been squatting for a long time, bro. But I did it. I made that very small change, and it's transformed my game with squat. And sometimes that's all that's needed is a small change. And we've designed nice healthcare to be a small change. We don't make anybody use nice healthcare. We don't make anybody have the free pizza delivery, right? Like, you can go to your pizza place and pick up the pizza if you want. Like, they don't make you get it delivered. Same thing with nice healthcare. We made it very easy, and we made it in a way that it should be budget neutral. Because I knew that was a requisite. I've been talking to mayors all over the country. I was in DC at the end of January, and there's a national conference of mayors. They're all there. It was crazy seeing all these mayors from all over the country, names I've seen, faces I've seen on TV, people I didn't know, but they all had the same complaint when it came to healthcare. They have a city budget that's funded by taxpayers. They're not like a company that's trying to grow revenue and grow profits. If anything, they're trying to shrink their revenue. They don't want to increase tax rates on their citizens, but yet they have their healthcare costs going up. Like an incredibly tense, issue that they're dealing with. And so nice healthcare is designed to be budget neutral. I'm just going to check my time here. So where does nice fit in for employers? If you're fully insured, nice healthcare isn't going to save you money out of the gate. I'm just going to be honest. Like, some people have told me I'm too open, I'm too candid, like I'm too honest. I'm just gonna be honest. It's not gonna save you money out of the gate. It's gonna save your employees money, all right? It's gonna save your employees a lot of money, but it's not gonna save you money. It should result in lower premiums over time. I'm gonna skip a couple slides here. If you're self-funded, nice healthcare starts saving money right away because you're diverting that care from a high-cost setting to a lower-cost setting. And I will admit that should happen with any DPC partner that you work with. So it's not just nice healthcare. That is one of the core tenets of direct primary care. It's a lower cost, but increased access. Somehow we do it magically. How do we do it? It's by removing a lot of that waste, removing a lot of that middle stuff that isn't adding value for patients and for employees. We work with employers of all types. When I used to get started, people would always say, oh, you're only for big employers. Like, oh, you're only for this type of industry or that type of industry. We work with all industries. We work with all industries. We work in all regions. One of my co-founders lives in rural Minnesota, like very rural, like super rural. I'll leave it at that. And she's brought an incredible insight to nice healthcare that has brought a focus on rural healthcare needs. But one thing I like to remind people of, again, is there is no rural or urban or suburban with healthcare. There's a healthcare problem that we will all be better off if we fix it. And so nice healthcare works in all of those settings for employers of all types. And I'm going to end on this. What does success look like for nice healthcare? This is one of our clients. They're just like any other client, Weld County School District number 6. They're based in Colorado. and they joined Nice Healthcare in 2023. A really exciting client for us. We love education partners because we can really feel, the impact that we're making on the community. What I have here at the bottom there is their utilization rate. And their utilization rate, as we like to see at Nice Healthcare, increases year over year. And the reason that utilization rate is so important for us as a point solution, as you might think of us, is if people aren't using Nice Healthcare, it's not doing anything. You heard it earlier today, if you're not going to use direct primary care, don't sign up for direct primary care because you're going to be double dipping. We heard that today. I absolutely agree with that. So you have to engage employees. We've built an incredible muscle at Nice Healthcare to engage employers and their employees to get that utilization rate as high as possible. And so we like to see that utilization rate increase because the higher that utilization rate is, the more people are saving time, the more they're saving money without forcing a change on them that they perceive as negative. All these people are choosing to use Nice Healthcare. Another client of ours, so this is a smaller one. I want to give you a bigger one and a smaller one to show you that it works for employers of all sizes. And just to kind of read, we have employers with as few as 5 employees using Nice Healthcare. We have employees with 2,000 employees using Nice Healthcare. We can see there again, at a small employer, seeing the same type of success that we see at a large employer. So I'm going to stop here and see if there's any questions on statistics, ancient Greek, healthcare, anything you want to ask me, feel free. Oh, the cliffhanger, the book of Revelation. All right. So, thank you. My analysis showed that the author that we attribute to the book of Revelations is most likely the author of the book of Revelations. And that is John, the disciple of Christ. So the pastors in the room were very pleased to hear my conclusion. Yeah.
I don't necessarily have a question. We are from rural Minnesota, so we have been a client of Nice Healthcare now for the last 2 years. And this is an unbelievable program for our employees, and especially myself as a mom. And our utilization last year ended at 36%. We have Nice Healthcare room in our facility, so even if an employee needs to be seen and they're at work, we have a space set up for comfort and so they can go there. And it has just been incredibly, altering for our employees to be able to utilize Nice Healthcare.
I'll just go ahead and say my question. Oh, here we go. So love this. I think this model is incredible. Have you guys entertained the idea of making Nice available as a part of some of these federated or syndicated DPC networks? So a great example, there are entities like Hint that would bring a bunch of DPCs together, syndicate them on behalf of a larger, more distributed employer. This seems like it would be a wonderful bolt-on solution to something like that. So I don't know if you've approached that concept or not, but it would be really interesting. We think about it, putting my Hancock Health hat on, we have a lot of employers that, we can service them geographically inside of our service area.
Yes.
What do we do outside of that? Platforms like this would be incredible solutions for health systems that want to operate beyond the bounds of their geographic service areas or their catchment areas.
It's a really good question. The short answer is yes, we have thought about doing that. It's kind of funny though what happens. If you ask someone, hey, you want to drive to get your pizza or you want to just have it delivered to you, assuming the quality is the same? They're like, oh yeah, no charge. They're like, oh yeah, I'd of course like to have it, delivered to me. So then there becomes some anti-competitive stuff in there then I'm like this aggressive entrepreneur, right? So it's like, I want everybody on my DPC platform. And so there's some things to work out there to figure out how to play well with physical DPCs. Oh man, I was afraid someone would ask that, that question. And believe it or not, the company started as a direct-to-consumer company because my vision, I was like this purist, right? I didn't want to have to go through intermediaries. I was like, I just want to go right to the consumer. But I knew as a statistician that there'd be some adverse selection, like who's going to sign up for an all-you-can-eat home delivery, medical service, and so sure enough, adverse selection is a real thing. So we had to, and so then we had to jack the price up, which then became untenable. And so that's the main issue is how do we come up with a price point that works for a direct-to-consumer model while still staying true to our roots. So we're still wrestling with this, still trying to figure it out, but we haven't solved it yet.
All right. Elizabeth, one more question. Go for it.
Yeah, so the short answer is we do not service emergencies. So we're not an emergency service, and we're not what I would say an inappropriate urgent care. There's some urgent care should be in primary care and some should be in urgent care. And so our app uses technology, processes to quickly jettison those people from the process of scheduling and get them to an emergency center as quickly as possible if they're mistakenly thinking that we can handle that emergency. Yes, so Nice Healthcare is not health insurance, and we're not a replacement for health insurance, so it doesn't require any changes to the benefit structure, typically, for an employer, so that user, the patient, would still have their traditional health insurance to lean on.
Everyone give a round of applause for Thompson.
Thanks for tuning in to Risk and Resolve. See you next time.